Hi, my name is Debbie Garcia. I'm an FNP student at UTEP. I'm going to be doing a comprehensive assessment on my patient. Could you please state your name?
Isaiah Benny Hernandez.
Your date of birth, please.
February 23rd, 2004.
And how old are you?
20.
Okay. So, first of all, I'm going to start off with the hair, examining the quantity, distribution, and texture. And he does have plenty of it. He's not missing any. So that's within normal. I'm going to do the scalp. I don't feel no lump, no lesion, no scaliness. On the skull, there's no deformities, no depression. Do you feel any tenderness? Do you feel any tenderness?
No, ma'am.
Okay. The skin, it does appear with normal pigmentation, texture, and he does have normal distribution of hair. Okay, his face, it does appear symmetrical. No edema noted, no masses, no involuntary movement. I'm going to palpate the lymph node. Okay. Any tenderness?
No.
Okay, they do appear regular in size. I'm going to look at your trachea, so sit straight. Okay, the trachea appears not deviated. I'm going to examine the thyroid. Okay, no abnormalities noted. Okay, I'm going to move on to the eyes. Okay, this is going to be the visual field. So cover one of your eyes. And follow the pen. Cover your other eye. Okay. I don't notice no protrusion or deviation. I'm looking at his eyebrows now. They're full. The distribution is even. No scaliness noted. The eyelids and the eyelashes, I don't notice no lesions, no edema. And the color does appear normal. On the lacrimal apparatus, there's no swelling, no dryness noted. Do you feel your eyes dry? Do they burn or anything like that? Okay, I'm going to look at your conjunctiva. Look up. Okay, it does look pink and moist. Good, within normal. Okay, I'm going to look at the cornea now. It's supposed to be with a lens, which isn't available. Here we do. I'm going to look at it with this light, okay? Okay, look your eye. Okay, the pupil look normal in size. They're symmetrical. The pupil reaction is perla. Okay, now you're going to follow my pen, okay? Just your eyes. Okay, now I'm supposed to, with an ophthalmoscope, look at the optic disc, the cup, and the retina. But UTEP did not have any available. They only had a certain amount. So I wasn't able to get one. Okay. And we do move on to the ears, the auricle. I don't see no deformities, no lumps, no skin lesions. Is there any tenderness?
No.
Okay. So I'm supposed to look into your ears, okay, to look for any foreign bodies or any discharge. The tympanic membrane, we would be looking for normal color, the contour, and looking for perforation. Okay, now I'm going to do the whisper test.
Banana. Bread.
Okay, he did do those answers correctly as well. Okay, And now we're gonna be looking at your nose. Have you noticed any changes in smell?
No.
No? Okay. So I'm supposed to, I don't see no deformities. I do see your nose deviated a little to the right. Okay. Now do me a favor and look up. Okay, I'm able to see a polyp on the left. Okay, but besides that, I don't see no obstruction. Okay, I don't see no ulcers. And I'm gonna palpate the frontal sinuses. Do you have any tenderness?
No.
Um, Now we're gonna do the motor system. We're gonna do the body position. So do me a favor, you can stand for me. Okay. I don't see no involuntary movements. No atrophy noted. Okay. We're gonna do the muscle strength now. So if you can sit for me. Okay, we're gonna do the shoulder abduction. Okay, there you go. Let's do the right one. Okay, don't let me push it down, okay? Now we're gonna do the elbow flexion. Finish this one. Okay, now the extension. Okay. That so far is measured at a grade 5. We're gonna do the wrist flexion and extension. Don't let me push up. Okay, now. Okay, let me try the other one. Okay, good. Now we're gonna do the finger extension. You're gonna bend your wrist. I'm gonna put resistance on your fingers and push. Okay. Same thing to this one. Push. Good. Now we're gonna do the thumb abduction. Gonna push downward on your thumb, push up. Good. Okay, good. We're gonna do the hip flexion and extension now. You can lay down. You're gonna lift up this leg. I'm gonna put pressure. Don't let it fall. Now the other one. Okay, good. Now let's do the other one. Good. Push up now. Okay, good. That's the measuring at a grade 5. Now we're gonna do the knee flexion and extension. If you can lay on your stomach first. Okay, so bend. I'm gonna put pressure. Okay, good. The other one. Good. Now if you can turn around and sit down, please. Okay, you're gonna push up. Good. Let me see this one. Okay, good. That's measuring at a grade 5. Now we're gonna do the ankle dorsiflexion. So if you can lay flat on your back, please. Push. Good. Now pull. Good. Okay, that's a grade 5 as well. So we're gonna move on to assess the coordination. So do me a favor and sit down. Okay, you just right there. Now you're gonna put your hands on your palm. I'm sorry, your palms on your leg, and then you're gonna. Good. Good. Now you're gonna do the finger tapping. You're gonna do the thumb with the finger, and then backwards. Continue to do that until I tell you. Okay, good. All that is within normal. Now we're gonna do the point-to-point movement. We're gonna do the finger to nose test. Okay, so with your index finger, touch my finger. Okay, now your nose. Now we're going to do the heel to chin. So your heel across your chin. Good. Now your other one. Very good. Now we're going to assess your gait. So if you can stand up for me, please. You're going to do a casual walk. Okay, just walk normal. Okay, come back. Now you're going to walk on your toes. Okay, now your heels. Good. Now you're going to go back and you're going to walk from heel to toe. Heel to toe. Okay, the gait is all within normal. Now I'm going to assess the Romberg test to see if he sways sideways. So do me a favor and stand straight. Okay, I don't notice no swaying. Now could you close your eyes for me, please? Okay, I don't see no swaying either. Now we're going to do the muscle strength reflexes. So if you can sit down for me, please. And okay, first I'm going to check the bicep reflex, which is inside of the elbow. Then the tricep reflex, which is behind the elbow. Then I'm going to do the brachioradius reflex, which is within the wrist. Then the quadriceps. Okay, and then the Achilles. Okay, so all those are within normal. If you can do me a favor and lay on your back. Okay, I'm going to check your stomach now. Okay, the reflexes to your stomach. Okay, I'm going to check your plantar, okay? Now I'm going to move on. Okay, well, hold it. We're going to do I'm going to check the cranial nerves for the optic, the ones I'm missing. So I'm going to do the optic. So if you can cover your right eye and read what's on the wall.
FP.
Okay, cover your other eye. Read it, please.
FP.
Now uncover both. And what do you read?
FP.
Okay. Then I would be measuring the pupil size. Okay, look this way. Okay, that would be measuring about a 7. Okay, and they are symmetrical. Okay, then I'm going to be shining the light in your eyes, okay? Okay, I do see color. Now if you can follow the pen, okay? Good. Okay, now we're going to be looking at your facial cranial nerves. Do me a favor and raise both eyebrows. Okay, frown. If you can close your eyes tightly. Show me your teeth. Okay, you can open your eyes. Smile. Okay, now puff out your cheeks. Good. Okay, now we're going to do the we did that one already. The glossopharyngeal in vagus. So do me a favor and stick out your tongue and say ah. Okay. Now we're going to do the spinal accessory. I'm going to put my hands on your shoulder, push up. Good. Now your face, push that way. Now this way. Good. Okay. Okay, now we're going to be moving on to the lungs. I'm going to be looking at his respiration. Okay, they're about a 10. Their depth is normal. I don't notice no tachypnea, no signs of respiratory distress. Now I'm going to examine the anterior and posterior chest. If you can lift up your shirt, please. Or can you take it off for me? Okay, can you turn up the next one? Okay. I don't notice no abnormalities. It does look symmetrical. Okay, no deformities noted. Now I'm gonna palpate the chest for tenderness or bruising. Do you feel any tenderness?
No.
Okay, good. Okay, now I'm gonna percuss your chest. Okay. If you can do me a favor and try and turn around. Good. Okay, you can turn back around. Okay, now I'm gonna auscultate your chest, okay? So when I'm auscultating, if you can please just do me a favor. Okay, I'm gonna auscultate the front first, okay? I'm gonna auscultate the back. Okay, now I'm gonna auscultate again, but make sure you say 99, okay?
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay.
99.
Good. Yeah, that sounds within normal. Okay, now we're gonna be doing the cardiovascular. Okay, I'm gonna be checking his blood pressure. Okay, blood pressure is 110/60. Okay, I'm gonna measure your heart rate, okay? Heart rate is 64. Okay, now we're gonna measure the jugular vein venous pressure on that one. Would you head to the left? Turn your head to the left. Okay. And then we would measure the ventricle distance between the highest point of the sternal angle, which usually is going to be 3 centimeters. Okay. Now I'm going to auscultate the carotid. Turn left. The carotid does present bilateral, no brewing notice. Okay, I'm going to palpate the carotid. Okay, it does feel smooth. Okay, now I'm going to inspect the anterior chest wall. Okay, so what you can do is do me a favor, Nita. Could you turn for me slightly to your left, please? Okay. So what I'm going to do, I'm trying to locate the apical pulse. Now lay back on your back. Now I'm going to palpate the precordium. Okay, no keys, no drills. And I'm going to palpate the systolic impulse, which is usually the right at the fifth intercostal space and the mid-clavicular line. Okay. Okay, now we're going to be looking at his abdomen. It is symmetrical. I don't see no abnormalities, no pulsation, no abnormal movements. The temperature is normal to touch. The color is normal. No noted scars. I'm going to listen to the ball sound. Ball sounds are normal active in all four quadrants. So I'm going to percuss lightly. And I'm going to palpate. Do you feel any tenderness? And then right here we try and look for the liver edge. And then I do check for peritonitis. Do you feel any pain?
No.
Tenderness when I did that?
No.
Okay. So we try and estimate the liver size. It's usually about 7 centimeters. Okay, do you have any tenderness when I touch there? No. Okay, so no tenderness, no right there. Now we're gonna percuss on the spleen. And palpate any tenderness. So now we're gonna do the kidneys, if you can sit up for me. Anything?
No.
Okay. If you can lay back. I'm gonna be touching the urinary bladder. I don't notice no distension. Any tenderness?
No.
Okay. And that is the end of the assessment. Thank you.